Thank you, Presiding Officer. I thank my colleague really for raising this important issue. Cabinet Secretary, all the talk has been about more money for the NHS in order to tackle waiting times. In fact, the very reason Wales is getting so much extra funding is due to the money the UK government is spending to tackle NHS waiting times in England. However, pumping billions extra into the health is not the answer to tackling waiting times. We need to direct spending into social care, and that means directed funds to local authorities. Cabinet Secretary, how will the Welsh Government ensure that social care is properly funded in order to eliminate delayed transfers of care, which you mentioned earlier?
Well, Llywydd, of course, I agree with the member that investment in social care is part of a solution to the pressures which the system in the round experiences. From the point of view of the individual, it really doesn't matter whether the money is being spent in the health service or in social care, provided they get the service that is the one that they themselves need. I think there is a wider point, though, than the one that Altaf Hussain has made this afternoon, which is that historically, in all public services, we focus on supply. We supply more services, we create more of this, we provide more of that. Whereas, in fact, we need to look at demand in services as well. Why do people present themselves for care in the NHS, particularly when the conditions that they present with are conditions avoidable if different choices are made and different sources of help are available to people earlier in the progression of the difficulty that eventually means you need a secondary care service. So rebalancing the way our public services not only are funded, but in the way they approach the work that they do, so that there is more emphasis on helping to deal with demand rather than simply dealing with the consequences of demand once that demand has crystallised.